Alright, people. Today we're going to have some fun. I'm going to read some dictation from a neurosurgeon. And let's just see how it goes. I don't have a question and answer person with me, so I think you can probably figure it out. Maybe I'll just raise my hand. Ready? This is going to be the question starting first. In reviewing John Smith's medical history and records that are documented here, Doctor, what injuries are noted on this child? He had what we call an acute subdural hematoma, which is as a result of head trauma. You end up having some of the veins between the brain and the skull rupture, or the direct injury to the brain, what we call brain contusion. And some of the blood seep into this space between the brain and the bone, and this is what we call a subdural hematoma. Okay, did the child have any other injuries on him? Related to the brain, you mean, or something else? Related to anything, related to the treatment of that child during that time. Was there bleeding in his retinas? There was. Well, first thing they noticed in the emergency room that he had ecchymosis on his legs, like contusions on his feet, and the ophthalmologist, Dr. Jones, noted some pre-retina hemorrhages on the left eye mainly. Okay, so pre-retinal hemorrhaging, is that bleeding in the retina? Retina, yes. Okay, that's the eyes, right? That's the eye. Okay, and ecchymosis is like a bruise? Like a bruise on both feet. Okay. With respect to the subdural hematoma, it's what you described essentially bleeding between what's the brain and the bone? Yes. Okay, and what does it do? You see, it's not just bleeding between the brain and the bone. There's brain and there's a thick membrane called the dura, and then the bone, so the subdural hematoma is a bleeding that occurs between the subdura, so it gets inside between the membrane and the brain. How was that? Just curious what you think about that, and if that was fun. It's a necessary thing in court sometimes, and by the way, that doctor had an accent, and he was from Lebanon. But sometimes that's what we do in court, and I want to give you a taste of it. And if you like it, I can do some more sometime. Thanks.